Hello and welcome to Senior Connections. This is our monthly look at all kinds of issues that are relating to older adults, their caregivers, their friends and family. Senior Connections is brought to you by Senior Resources, which is your area agency on aging serving Muskegon as well as Oceana and Ottawa counties. And we come here every month to try to help you navigate what can be a confusing web of services for older adults. And so we hope that you'll be interested in our topic today. We're going to talk about the MI Choice Medicaid Waiver program. I'm very excited to have two of my colleagues with me from Senior Resources, Andrea Douglas, who supervises the Options Counseling Department. She was here with us just a couple of months ago to talk to us a lot about that. And then we have Sheyenne Cole, who is our MI Choice Waiver Director. Welcome, ladies.
Thank you.
Thanks for joining us. So before we get into the nitty-gritty of some of this, why don't you start by telling our viewers a little bit about yourselves? Andrea, we'll start with you.
Sure. I'm the Options Counselor Supervisor. Been with the agency almost 7 years. Started out as an Options Counselor and then now supervising the department.
Okay, and we'll talk a lot more about that in your role, but as I said, she was here just a couple of months ago. It is truly the gateway to our services to everything at Senior Resources. Sheyenne, how about you?
Hi, my name is Sheyenne Cole. I'm the MI Choice Waiver Director with Senior Resources, and I have been with the agency for almost 10 years. I started as a social work supports coordinator, and I'm now the director of the program.
Wonderful. So we'll hear a lot more about your role. So, Andrea, as I said a couple of times, you've been here before, but let's just talk a little bit more about options because it really is the start of the process for the MI Choice Waiver program as well as lots of others, but let's talk about that. So what is the waiver program, the MI Choice Waiver? You'll hear us talk about a couple things. The technical full name is the MI Choice Medicaid Waiver Program. Sometimes we call it MI Choice, sometimes we call it waiver. We'll probably do waiver. So tell us about that program.
So yes, MI Choice Medicaid Waiver Program, but most people just know it by waiver. And that's when people call and they just call it waiver. So it is a program that's designed for people that meet nursing home level of care but want to stay in the community with help, but they need services to do so. So ultimately the goal is to keep people in the community and independent as long as possible. The waiver piece, and everyone kind of questions, what does waiver mean? What does that have to do with it? For Medicaid purposes in the community, the threshold's pretty low for regular Medicaid. The waiver program allows for a higher income for an individual. So for this year, for 2018, the income cap is $2,250 gross monthly income for waiver. So that's where they're waiving some of that spend, like they would call it a spend down or deductible. Okay. So that's kind of where the waiver piece comes into it. But mainly, all you need to know is that it's really for people that have that nursing home level of care but want to stay in the community and need some services to do so.
Okay. And we'll talk a little bit more about some of that, but it does and you might get into this in the next question about the eligibility, but if a couple is married, you could have one person who qualifies for this and one who doesn't, right? So let's maybe talk a little bit about the eligibility because it's besides the nursing home level of care, there's a lot of other things that you've
So first step, if you want to find out if you're eligible for the program, call one of our options counselors. And they're available Monday through Friday, 8 a.m. to 4 p.m. You can call our 231-733-3585 phone number, speak with an options counselor, and if you specifically ask for the program, that's going to kind of trigger them to start talking to you about that program. Not to say that they might not bring up other possibilities and options that might be a good fit for you along the way, but they're going to start that process. So for the waiver program, for eligibility, there's really three pieces. There is the medical eligibility, where someone has to meet that nursing home level of care. That's the whole purpose behind it, is for someone that's nursing home level of care and keeping them in the community. It's cheaper and it's where people want to be. So that's really what we want to do. So there is a Michigan intake that they have to do, that the state of Michigan gives us. There's questions we need to ask that tell us whether or not a person qualifies to go on the wait list. So the options counselors can determine that they qualify to go on the wait list medically, but really what it will come down to is an assessment by the team to determine that they are in fact medically eligible. So that's the first piece. Are they medically eligible to go on the wait list? Second piece is financial eligibility. So again, that $2,250 gross, and that's where it gets tricky for some because the Medicare premium comes out and they're thinking net, but then once you add that back in, you really have to be conscious of the gross monthly income. And then for a married couple, it is a little trickier because if we're only looking for one person, there's a difference between income and assets. So we're going to look at income, that's the $2,250. So if a married couple, husband and wife, let's say the wife needs the program, the husband does not, we're just looking at her income to see that she's below that cap. Not so concerned with the husband. I mean, we will get that information because we need that too, but that's not going to be the deciding factor for this person. Assets are a different story, and people get, it's confusing, but that's our job, is to help you walk through that. So assets are a little different. For an individual, the maximum liquid assets is $2,000 for this type of Medicaid. In married couples, it's different. And I wouldn't even get too specific about it. I would let you...
Probably 20 different ways of looking.
There really is. So talk to an options counselor. They can kind of walk you through it. They'll listen to the unique situation each individual, each family has, and then they can really let you know whether or not you qualify. So then now we have the medical piece, now we've talked about the financial, and then there has to be a long-term care service need. There has to be a need for the service to keep them in the community. So that's the three things we're going to be looking at, and then if the person appears to be eligible, that's when we're going to get all their demographics, and I know we talked about that a couple months ago. We're going to ask you a lot of questions, not try to be nosy, but you kind of have to be to make sure you're eligible.
Right.
Worst case, we don't want to start something that we can't finish. We don't want you to think you're going to get something and then find out you don't qualify. I mean, does it happen? Sure, sometimes things get missed or you might not realize there's an asset or whatever it is, but we're really going to try to ferret that out in the beginning to try to get you on the right program. So maybe it's not waiver, maybe it is a different program that you're more eligible for or more appropriate for. We're going to talk about that.
Great. Now you mentioned a wait list. So I was thinking, in all the years that we've done this show, we hadn't talked about this, and I was talking about it with another colleague. It's just probably because we've had a super long wait list in many years, so we wouldn't be talking about it. But what can they expect? I know every case is different, but what does a wait list look like now in July?
Sure. So for the waiver program, there is not a very long wait list. It fluctuates. You know, it really a lot depends on monies that we're given. There's a lot of factors that play into it, but there has in the past been a pretty significant wait list. Right now, the wait list, it's nice. It's short. It's actually pretty short. So if someone calls, even if we have no wait list, there's still going to be a process. It's not an emergency service. It's not set up that way. It's going to take time to get through the beginning to the end, but we don't have a wait list right now for the most part. Maybe a couple of weeks. And it's hard to pinpoint.
But we've talked months before.
Over a year.
Okay. Yes.
And there's prioritizations, and that plays into it too. It's like somebody in a nursing home, somebody that's in a nursing facility that has Medicaid and has a barrier but wants to transition back out to the community. They get priority. I mean, that's something that comes down from the state level, but that is, we want to get them back out into the community. So they would take priority, and then like an open adult protective services case might take priority. So those things can affect the wait list for someone just calling in a chronological or a first come first serve. So it's hard to narrow down the wait list because it can change from day to day, but it's way shorter than it's ever been. So it's exciting to be able to serve people faster.
So no matter what, there's at least some kind of wait. You're not going to have somebody come in, even do the assessment, and say, tomorrow you get services starting at your home. It just doesn't happen that quickly. But it's always good to remind people that a lot of those things, we are administering what's a statewide program. We're one of many waiver agencies, one of a couple in our community as well. But they're all over, and the rules are given to us, and we follow the rules, and we try to get things out as best we can and get people moving because we want to have people at home getting the services.
We want to serve people and keep them at home and independent.
So you're on the wait list, then what happens?
So once the options counselor has talked to someone and placed them on the wait list, when they come up on the wait list, so right now it's pretty short, so it's going to go for review, and then it's going to be put in processing. And like you said, there is actually another waiver agent that covers our area, so we share a wait list. Reliance Community Care Partners also covers Muskegon, Ottawa, and Oceana. We share a wait list, so it could be, we try to, as an options counselor, ask if there is a preference. Usually people don't have one. Right now, we've been, pretty much as people have been going on, we've been putting them into processing. So from there, we have a Medicaid liaison that if you don't already have Medicaid, or maybe even if you do, but there might be some question, like if you're married, there might be some questions about, because this is not just regular Medicaid, this is a long-term care Medicaid, so there's different rules. So we have a Medicaid liaison that will touch base with the person that wants to be on the program or their designated representative if they're not able. So she will talk more in depth about the finances, because that usually is the biggest hang up. So she's going to really dig into the finances, and if it looks like everything should be good for the waiver program, then it gets assigned to a team. Then it's going to be assigned out to a team of a nurse and a social worker to do an assessment, and then they'll determine the eligibility from there.
Okay. So it's a good time to remind, so again, everything that Andrea's just talked about, really up to that assigning of a team, is going through your options, our options counselor. So again, that phone number, if you want to call, is 231-733-3585. I think I have that number memorized more than my own phone number because it's so important. And again, they're there Monday through Friday from 8 a.m. to 4 p.m. You can call them if you need to. You can always schedule an appointment to come in and talk to someone in person. And if needed, if there's a situation they need to come to see you somewhere, they'll do that as well. We try to really meet people where they need to be. So now we've got somebody assigned to a team. So Sheyenne, let's talk to you. They're assigned to a team so it's an RN and a social worker. Talk to us a little bit more about those team members.
So when the program was created, the state really recognized the need for that medical perspective and the social perspective, so more of a holistic approach than some other programs in the state, to really meet an individual's needs and to assess what their needs are. So it's minimum of a licensed bachelor social worker. We have some social workers that have master's degrees, minimum of a licensed registered nurse, so we have some associate level, some bachelor level. And that initial assessment team, that holistic team approach, really sets the framework for that participant's case with senior resources. Once, and we'll talk through this, once they end up enrolled in the program, they may only have one discipline that actually manages their case. Okay. So it's really the initial framework to set, how the case unfolds.
So that first time when they're doing the assessment, they're meeting with both the RN and the social worker, but it might not necessarily always be that way.
No.
So talk to us about, what does that assessment look like? What are they doing there?
So
how long does it take?
Right. So it is question and answer format. There is not any hands-on to the assessment except for vital signs.
It's not a medical, okay, we're...
Right, let's do a complete physical.
Yeah, right.
Yeah, it is not like that. But there are several questions, and you had shared earlier, we're required to ask some of these things, although they're lengthy and sometimes tedious to the individual. It really gives us the full picture, and we need that to make sure that, first, they're eligible, and second, that we can meet those needs. So it's approximately a 2-hour process for that first initial assessment. Questions will range from medical history to current medication list. The nurse will actually say, okay, give me your medications so I can enter them in the system. Sometimes we're even helping find the medications around the house. So, it varies. We'll ask the financial questions. We'll confirm, that we think that the financial eligibility piece is there, although that is started with that first phone call to the options counselor. And then we'll do an eyes-on environmental assessment, and that's really to look at, are there any safety concerns, any medical equipment needs? Medical equipment could be a bath bench. If we look and we say, how are you getting into that bathtub? That's really not safe. So I think that that's really what to expect. The feedback from some of our teams is sometimes they go fast, sometimes they go long. It really, really depends on how much people want to share and who's present at the assessment.
Well, and so who can be with them at the assessment? They don't have to do this on their own.
They do not have to do it on their own, but the great part is if they want to do it on their own, they can. So oftentimes it's family members, brothers, sisters, mothers, fathers, sometimes depending on the age of the individual. It could be a neighbor, it can be a friend. It's really up to that individual. So that team, whoever's calling to schedule that assessment, will say, is there anyone else that you want me to call? Okay. Is there anyone else you would like present? So it's really looking at that person-centered focus, which we will talk a little bit more about in a few minutes.
Right, so you do this assessment, and then how long, besides the couple hours it might take there, but how long does the assessment process take to get rolling along? I'm sure it depends on whether they have Medicaid already.
So there's basically 2 different tracks that will happen. So if someone does not have Medicaid, that process of, if it's the Medicaid liaison that may actually come up to the house or meet with the family to help them apply for Medicaid, that may already be in the works. If not, then it may be the team, the social worker on the team that is helping with that. So let's say they don't have Medicaid, we go through the 2-hour initial assessment. The social worker, Medicaid liaison, some of that paperwork may happen during that assessment and may be scheduled later. Okay. Ultimately, an individual needs to be Medicaid eligible within 60 days of that initial assessment. Okay. So during that time, we're helping. We understand fully how difficult the long-term care world is, and Medicaid is honestly its own beast. And there's
a reason we have a liaison, isn't there?
Correct. So within 60 days, so if it happens sooner, then that information is turned into the Department of Health and Human Services. So we can't process our own Medicaid applications and actually determine eligibility. And Andrea had talked about assets and income and things. So some of those system checks happen when that paperwork is actually turned in. So it may be longer than 60 days. It may be found there was an asset you didn't share with us. So now, we didn't know you had it. So we think everything's good to go. Well, it might mean, okay, what can we do? Do we need to spend down? Do we maybe need to look at, if it's a married couple, what do we need to do with those assets? So there's a lot of ifs, ands, or buts. But within 60 days, they need to be Medicaid eligible.
And then actually going back to that, and I was thinking with the wait list, even to go on the wait list, you have to be able to be Medicaid eligible within 60 days. That's actually something that is important. Otherwise, if you aren't going to be eligible within 60 days, with how short our wait list is right now, especially, we're going to end up talking to you. You can't get eligible in time, and then removing you, and we have to start all over, and it's not fun for a person to go through that over and over. So we want to get into the 60-day is when we can put you on. If you can be eligible within 60 days, then we can put you on financially eligible. And that actually backed me up to, as you said, for their age, moms and dads, reminded me that for the waiver program for eligibility, they have to be 65 and older or 18 and over, but certified disabled through the state or federal government. So that was just another eligibility piece. That.
And we do have some participants who are under 65. So you mentioned person-centered planning. So let's talk, what does that mean?
I did want to just say one more thing about how long the process takes. So if someone has active Medicaid, our Medicaid liaison may or may not reach out to them before that initial assessment happens. But let's say it's perfect, the process went as it should. I would say an estimate is within 1 to 2 weeks of that initial assessment that they will actually have services implemented.
That's pretty quick.
So I wanted to share that because we do have people that are referred that already have Medicaid. So
that makes it easier. So let's talk about that person-centered planning, though.
Yeah, so person-centered planning really was designed and really kind of like adopted by the state of Michigan to let someone be in charge of their care. So it's really looking at, what do they want? What are their desires? It's not a nurse or a social worker saying, this is what you will have, this is what you're getting. It's more, an example would be, do you have a choice for a provider agency for home care? Do you have a choice for who we have come and widen the doorways? Things like that. So it allows choice, but then it also helps facilitate goal setting. So a common goal that we hear is, I want to live in my home. I don't want to go into a nursing home. I don't want to go into an institution. So then the role of the team is to look at, how can we help that person achieve those goals? So we look at, so we completed the assessment, our supervisors, our team at the agency met, and we feel that, 4 hours a day of care is what would meet your needs and help you continue to achieve that goal. So
I know that all situations are different, obviously, but what are some of the different services that we do offer? You talk about 4 hours of care. What could that look like? What kind of things are we talking for waiver?
So we can look at homemaking, so light housework, making meals. We can look at personal care. So maybe someone doesn't really need hands-on care in the shower, but maybe that aid needs to be there just in case they do.
Okay.
So, it goes back to that person-centered planning. What does that person want? Do they want them just so they can yell to them while they're in the shower if they need something, or do they really need and want that hands-on care? We can look at, I'll call it a life alert. So our formal name is a personal emergency response system. That's a common service. We have home-delivered meal providers. We can look at respite. So if there's a family caregiver that's informally, coming over and they want to go on vacation, we can implement an aide to come in and make sure the needs are met. We have adult day services. We have several adult day centers that we contract with. So it may be that there's that social isolation piece that they can get out into the community. We contract and pay for them to get there and spend, an average of 4 hours a day. Maybe they want to go once a week. It's really, really up to what that individual wants. We will look at, there has to be that medical need. So I want to circle back to that, and it goes back to the 3 prongs of eligibility. So, there are people that may want more than what we think they're eligible for, but it's a conversation. So,
Because you've got to be able to prove to the state, or the
Absolutely.
federal government that's providing the funding that there's a need for this. So
Right.
you might want to go out and socialize 5 days a week, but if it's not medically necessary for you to do that, then.
And I don't want to sound like we deny service requests, because it really is not a common thing. It's just every situation's different.
Right.
Every family situation is different. Some individuals come and have family that's very involved providing a lot of care. Some come in that have no family that are involved. So it just really depends. Depends on the situation.
So case management, so you've got this team now that's there. How, so they set up the services. What happens after that?
So they will call within 2 weeks of that initial service implementation and make sure that you're satisfied with the services, that it's often enough. Maybe you're feeling like they're not coming often enough.
Okay.
Maybe, there was miscommunication and your bath bench wasn't delivered. So they'll first call and confirm that you're satisfied. And then after that, every 30 days, and that's a requirement that we have to comply with, one of those state regulations, the supports coordinator will call and just make sure, confirm medical eligibility, were there any financial changes? Have you been in the hospital? Are you happy with your services? Are you having too many services? Are you not having enough? Any major changes, and really just to make sure that everything's going okay, and that we're still going to circle back to that person-centered planning and looking at all of that individual's goals are they're where they're at, where they want to be with their goal setting, and then every 90 or 180 days. It may be both disciplines, the RN and social worker, it may just be one, will go and do a home visit. Okay. So it is not nearly as lengthy as that initial assessment.
But they're doing reassessment.
Yep, they're reassessing.
In person besides the on the phone kind of things.
In person, they're looking at more updates. Okay, have there been any medication changes? When was the last time you saw your physician? It's things like that. And then they'll go and they'll review that person-centered plan. Where are we at with our goals? Are your needs being met? But to circle back to that 30-day contact phone call, generally participant family are calling the supports coordinators within that 30 days. So, and that's what that role really is. It may not just be MI Choice Waiver services that we're talking about. We need to make sure, it may be, I need to change PCP. Where would I look for another primary care physician? Right. So we would give that information. So we're constantly addressing all of the needs, not just looking at what the services are that we're responsible for.
So when should a participant absolutely call their coordinator? I mean, they might if they have those questions, but is there certain things that you say, please call Sheyenne and let her know
Yes.
this?
Absolutely, we want to know if there's an issue with the home care. It may be my caregiver, I don't feel like she's staying the amount of time that you said I was going to get. My caregiver didn't show up. Or it might be, I'm in the hospital. We need to know that because we need to tell the caregivers not to come.
Right.
And tell the home delivered meal drivers don't deliver the meals. If there's any major changes, so could be medical, financial, it could be a change in the informal supports. Maybe daughter was living in the home and then she moved out. Well, that's a big deal because we need to look at, go back out, do a reassessment. Do we need to increase care? So those are just some examples. I would say just even basic questions. Basic questions.
Anytime they have them. Perfect.
That's what we're there for.
So we just have a couple minutes left, ladies. So both of you, if you had one piece of advice, Andrea, for our viewers, what would you say to them?
I guess I would say don't wait till it's a crisis. Call when you, or at least find out what your options are. If you notice that there are issues and you see something happening with yourself or your loved one, and you're starting to have some concerns, not necessarily just waiver, but any program, call ahead of time. Start planning ahead a little bit and say, you know, I've noticed memory slipping. Just what's out there. So I guess my biggest, be aware of what your options are. Don't wait until you've hit crisis point, or if you're a caregiver, you're burnt out. Try to get ahead of it so that we can better help you and better serve you and try to help you keep from getting to that point.
Because if we're at crisis, you've just said minimum of, even if everything's in line, you're at least 2 weeks out.
It's a
And
process.
possibly.
It's a process. So
Right.
we would rather get you going before it hits that point. I guess that would be my biggest advice, is to call before it becomes a crisis.
Cheyenne, we got about a minute left. What's your advice for somebody?
I would say that my advice would be that there is a myth that individuals that live in a nursing home, that there are not other options, and there are so many options to assist in transitioning people out of nursing homes. So I think that that's something that, you know, it maybe it's something generational, and we've kind of been a secret. The My Choice Waiver program has been a secret, but it needed to be because we had such a wait list.
Wasn't a secret to everybody.
We have transitioned people out of nursing homes that have been there for years. So
Great. All right, so in the last
Definitely.
half minute, yes, call us. So you've heard a lot about the waiver program. It's really important to, again, call our options counselors Monday through Friday, 8 to 4, 231-733-3585. If you can't remember that, as I tell you every month, call 211. That simple 3-digit number will get you what you need, and they'll happily help you get to us. Thank you, Andrea and Cheyenne. This half hour goes so quickly when you're giving good information.
Yes, it does.
We hope you'll join us next time and find out more about what's going on in your neighborhood. Thanks for joining us.